Okay, so we are online now.
Let's wait until 12 sharp and then we start.
Clara, you said 5 minutes, right?
That's the idea. Short opening speeches, and then like to have more time to really engage with the audience and perhaps explore, you know, themes that are common in all presentations. So 5, 7. Well, Chang'an is not here, so we can take 7, right? We can expand on it. But I will post messages on the chat to let you know how the time is going.
Great.
Yeah, and so let me introduce myself here. I will introduce myself now. I'm the coordinator of the masters, and I will say yes, hi to all of you, present the seminar, and then Clara is going to introduce you and moderate the session, okay?
Great, thank you, Christina.
When do we know when we start?
I think we can start. I hear
I have 11:59.
Ah, let's wait. Like what I hear, you know, the bell of the university clock saying it's 12. So it's like coordination is not working very well.
Okay.
But when it's noon on your time, Christina, feel free to start.
So maybe we start. Okay, so welcome to this NOAA webinar series. NOAA is the network in humanitarian action. We are 8 European universities, as you know, and we have 11 partners in the Global South. We have today with us our representatives from the University of Deakin, the University of Gajah and we have University Kevin Watkins from Save the Children, so one of the NGOs that is collaborating with us. We still have another 2 webinars. That will be the next one on the 25th of June, and that will be focused in Latin America. That will be in Spanish. So I would like to give the floor to my colleague, Clara Egger, the director of the Masters in the University of Groningen. And I'm sorry I didn't introduce myself. I'm Cristina Churruca. I'm the director of the NOAA Masters at the University of Deusto and coordinator of the Masters Consortium. So we are very glad you have joined us. And please, Clara, when you want.
Thanks a lot, Christina, for the introduction, and thanks to everyone for joining us in this busy times. So just a quick reminder on the rules for the webinars. I will introduce the speakers. I will introduce you one by one and give you the floor for 5 to 7 minutes, an opening remark on the leading questions of the webinar, which tackle the impact of the COVID in the Global South. So both on societies, on vulnerabilities, but also on humanitarian action, the changes we may expect in the sector or the continuity. And then we will open the floor for a question. So if I understand well, and will correct me if I'm wrong, you will be allowed to ask able to ask questions on YouTube as well as on Twitter, and I will receive, a group of questions. So there may be frustration because we may not be able to address all the questions, but we will try to group them. So I will ask the question to the speakers, and you will have the floor to answer to the question. I would like also to apologize on behalf of Dr. Shanyan Vedanaputi, because he's sick. So we are very sorry not to be able to have him with us today, and we wish him a very speedy and good recovery. So I would like to start with introducing Phil Connors. So he's a professor of humanitarian studies at Deakin University in Australia, and where he also leads the Center for Humanitarian Leadership. Phil is interested in the nexus between development and humanitarian action, and I'm sure you will have a lot of very relevant insights to share with us. So I give you the floor for 5 to 7 minutes of opening remarks, Phil.
I will unmute myself. So thank you, Clara. Thank you. Welcome, everybody. It's great to be here, and thank you for the invitation to be involved. Very interesting questions, and with through the Centre for Humanitarian Leadership last week, I'm going to refer back to something that we were talking about last week through in the centre when we had a webinar such as this, and we were looking at leadership and localization in COVID-19. And we had some very interesting speakers, Degan Ali from Adesso, speaking from Nairobi in Kenya, and Puji Pujiono from Indonesia, and Siali Ilolahia from Fiji. And they were talking about COVID-19 and the impact from the South from those different perspectives, which was very, very interesting. And they were talking about, say, Degan Ali was very much about, as Degan is, as many of you will know, very, very strong on localization and a very powerful speaker on localization. And as far as he was concerned, this is localization writ large. So the impact on the humanitarian action has been that limited amount of availability of the usual surge capacity. So internationals going into a situation, and that local organisations have had to step up to the plate and have been leading in those instances where there have been disasters and in conflict. And it actually fitted really interestingly with Siali, who they had just dealt with Cyclone Harold, Tropical Cyclone Harold, that had gone through Vanuatu, Solomon Islands and Fiji, and all of that had been dealt with by local organisations and local affiliates of INGOs, and that the governments had stepped up, the national disaster management officers had stepped up, and that localism, that the localization process had really progressed in all of that. And Ciali's key findings, and just to talk about COVID and its impact in the Pacific, it has had a very minor impact in the Pacific at the moment. It was thought that there would be a severe impact in the Pacific if it actually took hold there, because of the underlying burden of disease, such as diabetes and obesity and those sorts of things that are there. But it hasn't taken off. And Ciali was making a point that the only places where it has actually impacted within the Pacific, or the key places that it's impacted in the Pacific, are those that are not sovereign states, Guam, Marshall Islands, and so forth, that are territories. And they, in the Pacific, of the 22 countries in the Pacific, they are the ones that have had the most cases of COVID-19. So Ciali was talking about that notion of sovereignty and being able to make decisions for the population, and the impact of that for populations in those small island nations. Puji Pidiono brought a really interesting perspective from the Indonesian side, where there has been a relatively strong impact of COVID-19. And he was talking, Puji Pidiono is one of the founders of Sejaja, which in Bahasa Indonesian means equal. And that is actually a network of local organizations. And there's, I think, hundreds of local organizations that have started this network. And they've actually taken the localization agenda in Indonesia to the next level. They almost do what he was referring to almost as a raffle of they ask for input from INGOs, from externals, and then they put it up what they can deliver, and then the organizations within Sejaja will then choose what they need for their response. So it puts a very different face on humanitarian action within the Indonesian context. And the Indonesian government has been moving towards this for a long time. And this is in support of the Indonesian government in achieving what they want to achieve as sovereignty over any humanitarian action that takes place within Indonesia. And so that was a very different take within that. Coming back to Dagan was talking about the impact of, Adesso does a lot of work in Somalia, and she was saying that in Somalia that at the moment, the impact has not been great within COVID-19 either. And she was putting forward a theory that it had been responded to relatively well, even within a semi-conflict setting, and that even though there is an underlying burden of post-conflict and development issues and so forth, that because the nation was very, very young, that's one of the youngest nations on the planet, as in the demographics, that the impact of COVID had not been so great. So, and that there wasn't that burden of disease that was potentially in places like Italy and the UK and others where that was where they've had a greater impact. But all three of them were saying that COVID as such, yes, it needs to be dealt with seriously, and yes, it has an impact, but they're more concerned about the post-COVID impact of the economic impact and the impact that is going to have over the coming years, because they believe that is actually going to probably be a more severe for a great many countries that they've been dealing with, and I would argue that we have been dealing with as well, that the economic impact is going to drag this on over an extended period of time and will impact things like the role of humanitarian actors. It will impact on funding, and we already hear of institutional funders saying we're going to take away from existing programs and put it towards COVID. What are the impacts of those on those existing programs? So where there are programs running, they could be curtailed, and the impact of COVID is going to be felt far longer because of the economic impact than just the disease itself. So there were some really interesting turning points there, and it will make a change for humanitarianism in the future. I think there is not going to be a swing back to exactly the way it was in the past. I think the system was struggling as it was, and I think we're going to see that there is going to be more of a shift towards localization, more local organizations taking a lead within that. And it will be interesting to see how the system pivots towards that and what that will mean. And I'll finish up there with my opening comments. Thank you.
Thanks a lot, Phil, for very, very relevant comments right in time. I will now give the floor to Kevin Watkins, and thanks a lot for joining us. Kevin is the CEO of Save the Children in the UK, and he was before working with the Overseas Development Institute, publishing a lot of reference reports on humanitarian aid and aid and foreign aid in general. Kevin, I give you the floor for 7 minutes of opening comments.
You're muted, Kevin.
You're mute, Kevin. Kevin, we can't.
Sorry, you missed the best bit of what I was going to say. So it's great to be here, and thanks so much, Clara, for the introduction. Look, given that I've only got 7 minutes, I want to state very boldly and broadly what I think the problem is. And I think the problem is that we're dealing with a crisis which is unique and distinctive. And I'm going to come back to 5 reasons why I think it's unique and distinctive. But we're dealing with it with a toolkit from previous crises that are only partially relevant. And I think that's true if you look across the board. So policymakers in ministries of finance are treating this as though it's a rerun of 2008, maybe a little bit worse, but it's essentially the 2008 story. The humanitarian community, also the humanitarian architecture, is treating it as though this is just a large-scale global emergency, for which we do an appeal, the $7 billion UN appeal, the UN agencies divided up and put the money out. And the development community, the IMF, the World Bank, are doing what they always do in these crises, which is they wheel out a little bit more emergency financing. They take money that's already in the system and put it through a little bit more quickly. And the proposition I want to put to you is that this is completely the wrong set of approaches to a crisis on the scale that we're facing. And here are 5 reasons why. First of all, there was one pandemic in the 20th century, which is the Spanish flu pandemic. And there was one Great Depression in the 20th century, which was the depression that started in 1929. They were separated by a full decade. We have never had simultaneously a global pandemic and a global depression, and that is what we've got now, and that is a game changer. And moreover, the global depression is a consequence not just of the collapse in demand, but of a breakdown in supply, the disruption of supply chain. So this is uncharted territory. And the one thing you know about uncharted territory is you don't use your tried and tested maps to try and find your way through it. That's the first point. Second point is, and I say this from the perspective of an agency that's in the UK, we have a humanitarian crisis here in the UK. 50,000 people nearly have lost their lives. So the North, is part of the humanitarian emergency. And actually, it's a way bigger part than the traditional part. The Save the Children traditionally responds to the type of crises supporting local partners that Phil set out. The whole of sub-Saharan Africa so far has lost 2,000 people, reportedly, because of this crisis. The UK has lost about 50,000, Europe as a whole, 180,000. You try making the argument in the UK that there's a humanitarian crisis somewhere else that you need to respond to, and it doesn't work. And I think that is a challenge to the way that we think about the humanitarian response. Third point I wanted to make, well, Phil's already made it, but I'll just reinforce it, which is the second order impact of this crisis will vastly outweigh the first order health effects. There's recent modeling from Johns Hopkins Medical School, which indicates or projects if there's a 10% reduction in the utilization of basic health services in low-income countries, child mortality will go up by 250,000 in 6 months. That massively outweighs the potential health effects on children of the COVID crisis, and that is just a 6-month figure. Yeah, and this is before you plug in all the projections on rising poverty, on rising malnutrition, and all of those indicators. So this is, I would say, completely off the scale, and it's a crisis that will play out in the midst of the worst budget pressure that has been experienced in low-income countries in the last 30 years. So that's the third point. Fourth point, all of this demands a global response. And, you know, I hope I'm not treading on any sensitivities as I say this, but I think all of these distinctions between the humanitarian world and the development world have just been made. If they were ever relevant, they are now totally meaningless and irrelevant. This is not a humanitarian crisis in the old sense. It's not a development crisis in the old sense. This is a human crisis, which you need a full toolkit to respond to. You need the IMF and the World Bank to play a different role. You need the UN agencies to stop playing out ridiculous turf battles and cooperating and coordinating much more effectively. And the final point I'll make is, you know, there are plenty of reasons to despair about the situation that we're in, but this is also an opportunity to build back a better system, including addressing some of the issues that Phil has set out. But the one I want to just leave you with a reflection on is that I've been really struck over the last couple of months by the way in which the media has created a moral panic about ventilators in Africa. And the great discovery of the media is that there are very few ventilators in Africa. I mean, anyone who's been anywhere near an African health system could have told you that a long time ago. People in Africa, and in particular children, are not dying every day for want of ventilators. They're dying for want of basic oxygen, basic antibiotics, and basic health systems that don't reach them. So we have to stop this crisis diverting attention into issues that are frankly irrelevant and use it as an opportunity to build the universal systems that can make the world a better, safer, and more secure place for vulnerable people. Thanks, Clara. I'll leave it there.
Thanks a lot, Kevin, for your opening remarks. We'll also give a lot of insights and potential questions and discussion on the issue. I will now leave the floor to Siswanto Wilopo. Siswanto. So Siswanto Wilopo is a professor of public health at the University Gadjah Mada in Indonesia, and he's the director of the Center for Reproductive and Public Health, and one of the, I would say, leading figure of the public health community, both globally and in Indonesia. Siswanto, you have the floor for your opening remark, 7 minutes, and then we will engage in the Q&A session.
Thank you, Clara. Good afternoon for you, and we are already in the evening now in Indonesia. Can you hear my voice okay? Okay, I will share the answer, some question that you sent it to me before, and I put it on the screen, and allow me to share my my PowerPoint, but I cannot share right now because you are still using it. Can you disable the screen sharing first? Still disabled now? Somebody using it? Okay. Okay, I will share what Indonesia is already in progress for this COVID-19. And you send me some issues related to the development in Indonesia. And I will start with the situation of the country, and then I will end it with the implication for humanitarian in the future. As you know, by yesterday, there are almost 2,400, and today added more than 600 again. Death is around 1,500. And starting on April only, and 13th April, government has declared COVID-19 as national non-natural disaster. And then large-scale social restriction were implemented in major cities affecting socio-economic activity, including the special territory of Jakarta. Some provinces now are implementing big-scale social restriction for accelerating COVID eradication, but it is not lockdown policy. It's according to the head law, we call it PSBB. Now, let me show you in terms of number of confirmed cases among the ASEAN country. Singapore is the top, but the case fatality rate in Singapore is lower than Indonesia and the lowest in Thailand. And Indonesia is quite high because the total population, it is estimated now around 270 million. So Singapore only around 6 million. So this is really an issue that even we have not reached all of the population in Indonesia. We have already almost 18,000 now case positive. And you see in the corner here, this is the projection by John Hopkins Analytics. I just ran it yesterday, and we got expectation that the case is going to decline, but still quite some time from now. It is estimated by mid of June or first of week of June, the government will ease the policy on PSBB. Now, what government already acts on this? Of course, number one, we create regulatory and institutional response by the government. We establish what we call it Indonesian Task Force for COVID-19 Rapid Response. It is headed by National Disaster Management Office. Then Ministry of Health has power to issue implementation of epidemic law in the form of big-scale social restriction of PSBB. Now, Minister of Finance and Central Bank is responsible to guarantee funding any activity related to COVID-19, also maintain the monetary stabilization. We also involve military and police force to enforce PSBB, and Minister of Village Development, Disadvantaged Regions and Transmigration provide village funding for COVID-19 management. Now, I want to show you, this is the structure of Indonesian National Cluster System. And one of the issues is also related refugee and protection IDP. And the broader societal response, including religious, cultural tradition on the issue of this. Their role in pandemic can be both productive and counterproductive at the same time. There are a lot of clusters among pilgrim and also among this Islamic group and from the Christian community as well. Now, we also close the hotel and tourisms, and we also established the digital and media drive because, as we heard from previous speaker, that media is sometimes giving nervous to community because they produce what we call it hoax, This is also something that government is looking at it. But in addition to that, the digital and media also helping on the food distribution, on the infrastructure need at the household, and so on. Now, for the community response itself, is focused on the change in public health behavior. Three issues: staying at home, washing hands more frequently, and applied social distancing. Now, what was the experience from the country managing a pandemic, and what lesson have been drawn from the past crisis? SARS epidemic is provide lessons for us, but SARS is less, less dangerous than this COVID-19. It's not comparable between SARS and the COVID. And from the broader impact, we learn from ASEAN economic crisis 1998 may help government to mitigate the impact of COVID-19 on economic crisis. So the policy that was useful during the economic crisis has been re-established now, including bank subsidy to small enterprise and so on. Now, of course, there are multiple vulnerability. Who's the most vulnerable people? Of course, number one is the poor segment of the population, women, girls, older person with medical condition, and people with HIV, and then refugee, IDP also increased risk, healthcare worker, and also detainee and prison population. The government released around 35 prisoners because we do not want them to involve on the COVID-19. Now, how will the COVID-19 crisis affect pre-existing equality? Of course, two issues. One is the effect on livelihood, decreased income and increased vulnerability, increased food and security. Now, the poorer segment of the population is an urban area, more likely to live crowded condition. So exposed to the COVID is much more risky. Estimated around 20% of Indonesian urban population live in substandard housing, and urban population are more likely to be excluded from basic service, and single-headed household is also high risk for this. Now, what is the role of humanitarian actor? Of course, the international cluster-led work with their respective national counterpart to support response on the country. UN OCHA in this role as the inter-cluster coordination lies with the coordinating Ministry of Human Development and Culture and National Disaster Management or PNBB, who is responsible or leading the operational of day-to-day national task force. The National Cluster Working Group are facilitated and technically assisted by HCT and also UNCT. And currently this is happening at the national level with the expectation to be expanded to reach the most effective region in coordination with regional task force for COVID-19. Now, what are the initiatives taking place at the community level? Capacity to cope with additional pressure from the epidemic community is family community network is the first one. They are very strong in Indonesia. Collective response are normally more common than individual response in Indonesia. On the face of threat like COVID-19, people may seek family and community support as like their coping mechanism. Government also implementing PKH, that's it's basically giving coupon money to those who are needy. And as I said earlier, community involved in charge in public health behavior by promoting stay at home, washing hands more frequently, and applied social distancing. Now, what is the implication for humanitarianism in the future? Because you underline the importance of WAS. This is what already agreed between government and NGO and also international community related to WAS. Provides technical assistance, facilitate the WAS cluster, procurement in some area needed, engage on private sector to mobilize support for COVID. This one is specifically asked by Clara to me on the WhatsApp, but what will the reconfiguration of the contemporary humanitarianism? Of course, the protection vulnerable group is the most important one with the following priority. One is background initial rapid assessment, so protection mechanisms, referral pathway, access primary COVID prevention and hygiene supply, access to social financial assistance, risk communication, community engagement material, capacity building, awareness creation, support, and accountable feedback mechanism. Online legal counseling for people living with HIV and K-affected population is also being a thing for the future. And the most last one is the support of the community itself. So thank you. That's what Indonesian situation now. I hope they will, invite some comment or question after this. Thank you.
Thanks a lot, Siswanto, for this very comprehensive analysis of the situation on the ground in Indonesia. So we are waiting for some questions to arrive, but perhaps we can start by asking a few ones to you. I will start and then I will leave Christina perhaps adding her own question. My main point, you all refer to a second order, right, crisis, and not only at the health level, but also at the economic level. And one question that all of your presentations made me think about is also the political impact. So what will be also at the political level, the impact of the crisis on both, I would say, global North societies, and we saw, like you mentioned, Kevin, the Spanish flu and the Great Depression, but both events had a very strong impact also politically in Europe. So we may expect also a closing down, I would say, of societies. That could be a risk. So I don't know if you have any thoughts and comments on this political dimension and the impact of political changes on humanitarian work from your perspective. Christina, I don't know if you want to add another question to this one, or.
Yeah, well, thank you very much. I mean, Phil and Kevin Siswanto, for your very insightful comments. Yeah, I was thinking, I mean, in trying to pick up some of your headlines, the issues you made. I think, Phil, I mean, you start mentioning how we see a progress on the localization agenda, and how we are going to see a very long impact of this crisis. And then I think, Kevin, it really touched me. I mean, when you were mentioning this is really a human crisis. We cannot, it's really blurring the lines and this division between humanitarian and development. But also we see that humanitarian crises are not on the South. We are witnessing a humanitarian crisis in Europe and then the USA. I think we saw that already with the so-called migrant crisis, but we see here this is really a global crisis with a huge impact in both that we have never seen an economic and a human and a health crisis of this dimension. And I think something that uses one to mention really, we see that the vulnerable groups are the same all over, are really people that, I mean, poor fragments, I mean, the poorer sectors in society, migrants, and people in detention, people that are in prison. And this is being shown in Indonesia, but also in Europe and in different. But I mean, my question to you is, this could be, as you said, I think and you see there is a need to put a focus on protection, on investing on global and on health systems all over, and also in our countries, where through this the economic crisis we suffered from 2008, it's been really a reduction, yeah, in the investment in our health and protection systems. Do you think, I really see from what you were saying, it's an opportunity really to promote this coherent and more comprehensive responses that blur the lines between humanitarian development, to stop these starfelt fights between UN agencies, to really promote this coordination at global level. But do you really, I mean, I hope this is going to happen, but I would like to know, I mean, to think, do you think this is really an opportunity? But I'm a bit afraid that the responses we are seeing are not going in this direction. And I really hope we see this as an opportunity. So I would like to know a bit your reflections on this. I'm sorry for being a bit too long, but.
Oh, that's great. I don't know if you want to, perhaps the easiest way is to follow the order of the presentation. So feel if you want to comment on the question or perhaps also on the other presentation, right? Feel free to add any comments to what you just heard.
Sure. I think Kevin raised one of the most important points is that this is, as you say, Kevin, if there ever was a distinction between humanitarian development, it is no longer relevant. And partly that, for me, links back into a localization thing, because at that level, there is no distinction. You are doing what needs to be done at the time, and whether that be considered to be with humanitarian money or development money, that doesn't really matter. And I think that's a huge thing. The political impact, I think I fear you might be right, Clara, that there might be a closing down. There was already a move to a rise of nationalism, for want of a better word, less focus on the global and more focus on a national agenda. And we saw that around the world, and the US is a great case in point. Make America great again. What more of a slogan could you have to do that? And we were seeing that in other ways in a great many countries, and in Europe, that swing to the right, more nationalist understandings, and the implications of that for a global understanding. And I think what we have now, and even in Australia, that has been a strong supporter of a global trade system and stuff, now with COVID-19 turning around saying, we need more economic sovereignty. So we need to be less reliant on a global trading system, more focused on what we can produce ourselves and being more self-sufficient. If everybody does that, there is going to be a real challenge within that, because it is a challenge to the whole system. And if we're going to deal with a global pandemic, and it is a pandemic, and there's going to be an global economic impact, it is a human-centered impact, as was said. We can't afford not to be supporting each other. There can't afford not to be a system of support, economic support, and other supports globally. We can't be locked into a nationalist understanding if we're going to be able to move out of this in a global way. And I will leave it to others to comment on the other questions.
Thanks a lot, Phil. Kevin, yeah.
Well, look, they were both great questions, but they're really big questions, so it's hard to do justice to either of them. What I would say is that none of this is fixed, and in the end, this comes down to politics and mobilization and arguments that win the day. And I suppose, if you were pitching this as on the sort of pure evidence base, that what you would hope is that political leaders who have either defied the science or refused to act rapidly on the science and have killed many of their own citizens as a result, what you would hope is that they would pay a political price and be thrown out of office. And obviously, there are some pretty clear-cut candidates who would be in that category. The President of the United States, the President of Brazil, many prime ministers and presidents in the European Union, who, if you compared the response in the UK, to take one example, with the response in Indonesia, let alone Singapore, you'd have to say the UK was just 3 weeks behind the curve, and many people lost their lives as a result. So, you would hope that Enlightenment rationality would kick in. Unfortunately, there are so many strong political currents, as Phil has said, that are pulling in the other direction. My country first, my health system first. And, we've already seen the rise of vaccine nationalism. The US and some countries in Europe trying to make sure that they have the first claim on vaccines. We've already seen through the trading system of rich countries trying to make sure that they get the protective equipment, the medical equipment, before poorer countries. And, at one level, it defies logic, because you would have hoped, if the pandemic teaches you anything, it would be that all this bullshit about taking back control, make America great, this is a virus that doesn't listen to rhetoric and doesn't observe national boundaries, but yet somehow that very reactionary populism is proving quite resilient in the face of this, and that is a source of concern, and we have to mobilize against it. I would say, Clara, since you mentioned the Great Depression, the best economic history book on the Great Depression, Charles Kindleberger's book, makes it very clear, actually, that the interface of politics and economics was the critical factor here. And it was the mismanagement of the Great Depression and the attempt to solve national economic problems with beggar your neighbor policies that not only deepened the Great Depression, but also created the breeding ground for fascism and Nazism in Europe. And, you would have hoped that the current generation of politicians read their history, but that's a pretty vain hope. I mean, maybe, you guys are all in universities, maybe you could do some promotional work on that front. But I would say in the end, this comes down to very hard-nosed politics of making arguments in a way that galvanize the public. And that's a tough thing. Even in the UK, you can see the persistence of these take back control narratives that were very current during the Brexit debate being played out again. And I wouldn't say it's a majority, but it's a very persistent undercurrent that I think all of us have a responsibility to address as we try to communicate the fact that, in the end, this is a crisis of shared humanity. And either we come out of this together or we stay in it together.
Thanks a lot. Thanks a lot, Kevin, for your reaction to that question. Siswanto, do you want to add anything on this point, or perhaps elaborate on some of the issue you addressed?
Yeah, let me address the political impact of that. Of course, among ASEAN countries, including China, we are very strong in collaboration in mitigating the COVID-19. So China sent some medical equipment to Indonesia, but to be honest, actually, many medical supply that were used in China used to be produced from Indonesia. So that create new ideas for Indonesia, that the Ministry of who is responsible for this, government in company, BUMN, he make a very strong commitment that all of the government company should address to build new factory on the medical equipment. That's including my university also produced the corona test kit and respiratory and so on, respirator and so on. So that's one political impact to more nationalisms on producing medical supply and equipment. So that is the good thing with this crisis. So even the core materials for drug and so on now being built in Indonesia, because it used to be cheaper imported than produced ourselves. But now the time that when there are global competition on selling respiratory equipment and also medical supply and so on, you need to stand up by yourself. So the country now has been working on that. Now, let me also underline my statement that the government is coordinating the UN system and UN OCHA on the activity. They're part of the national body, so that all of activity has to be approved by that body. So a single institution to coordinate all of it. But of course, the implementation, even it's responsibility of central government, the implementation is paired to the 34 province and 454 district. That is something which is a little bit difficult in the sense that some community, they are not obey with the government policy on PSPB, for example. So that is the challenge for us now, what we call it new normal life. That's what the term now we are using it. It's need a lot of promotion, and the humanitarian action should go on that direction as well, because this is not a health crisis. I agree, this is a human crisis. Thank you.
Thanks a lot. We have some question asked by the audience, so I will just ask both of them. One is focusing on education and is as follows. Considering the reluctance of some traditional humanitarian sector to include education in the very first steps of the emergency, could this COVID-19 crisis become a context to endorse education as, cooperation and converging point between humanitarian and development agendas? So there's a first question on education has a converging point. And then the second question is more for Kevin, based on also the specific experience of Save the Children. The question was, given that this COVID-19 crisis has reinforced the localization agenda, how has Save the Children UK adapted their response to meet local and national action? So more information on what are the changes, right, implemented right now to address this localization need, and something more broader on education as perhaps the key sector bringing development and humanitarian agenda together. Phil, if you want to start on this question.
Certainly. Education as a nexus point, I think there's a growing recognition that even though there's been a long-held understanding that education is not life-saving, I think that's a false situation. Education as a long-term impact is crucial, and I think in humanitarian situations and these days the complex humanitarian situations that make up the vast majority of responses, education needs to be at the core of that. And I think education really is a link between humanitarian and development, and it's one of those things that would continue straight through. So I would hope that this would create a rethinking of that education is to be seen as a core part of any humanitarian response, because it really is one of those key parts of the nexus.
Thank you, Phil. Kevin, if you want to elaborate, especially on Save the Children experience in that regard.
If you don't mind, Claire, can I just stop for a few thoughts on education as well? So that question is a very timely one. So to be clear, something like 2% of humanitarian aid currently goes to education. And I've spent a lot of time with Syrian refugees in Lebanon, with South Sudanese refugees in Uganda. And when you speak to children, refugee children, and their parents, you get this overwhelming sense that they believe education is their passport back to recovery. And it's important for many reasons. It gives children who have been traumatized a sense of normality. It equips children with the skills they need not to get locked into poverty. And it's a long-term investment in recovery for their country. So the neglect of education by the international community, including the humanitarian community, is completely indefensible. And I think what the what the questioner is raising is the key point. So at the moment, we have about 1.3 billion children who are out of school because they're locked out of school. There's an immediate challenge of how do we keep education alive for all of those children, which is a distance learning challenge and a community support challenge. We have a challenge of when schools reopen, how do we ensure that all the children who are now locked out actually get back into school? And we know from the Ebola crisis that adolescent girls in particular are much less likely to go back into school. So you need cash transfer programs and other measures to incentivize the return of girls into school. And then you need to fund education systems to get all children back into education. So I think this is an opportunity, one, to do more for children who are facing a humanitarian emergency, like Syrian refugees, like Rohingya children, like South Sudanese children in Uganda and elsewhere. But if we don't build this back as a system that cuts right across the development and the humanitarian framing, the traditional framing, we're not going to get where we need to get. So I think there's a real danger now that we are going to see the biggest reversal in education that we've seen really in the post-war period. That is now, I would say, almost a likelihood. It's not a possibility anymore. And I think anyone who's in this seminar will know the value of education in their own lives. So this is a really critical issue for so many children around the world. On the Save the Children response, so we're responding in a lot of different contexts, Somalia, Yemen, with the Rohingya, where there's a traditional humanitarian element to this, but it's really clear in our response that these are system-wide challenges. And the second order effects of the crisis, of the lockdown, of reinforcing poverty, of economic decline, of budgets coming under more pressure. And, we're trying to respond in the way that we usually do by supporting local partners and driving the localization agenda. But I mean, Phil will probably say more about this. There are so many barriers to localization that, like donors around the world love to speak about the virtues of localization. They then create reporting conditions that make it impossible for local partners to get international funding other than through intermediaries in a way that is inefficient, imposes high transaction costs. So we're doing a lot in Save the Children to try and build the capacity of local partners to directly access international funding. But there are a lot of barriers to making that happen.
Thanks a lot, Kevin, for your answer. Siswanto, do you want to add on this point on education and localization?
Yeah, I think it is very important education to those who are on the high risk group, because most of those who are high risk group are not well educated, and it's difficult to change their behavior and their belief That's already evident in my country. Many subgroup of Muslim community, they just don't want to understand what is the impact of those three issues. Like what I said earlier, stay at home, washing hand more frequently, and applied social distancing. In this case, the next phase that we have to prepare and involving many humanitarian activity is really how to change the behavior to become what we call it a new normal. This is something that the humanitarians action can work to those high-risk community, to the urban in the dense area, and so on and so on. So I think I agree that education is another resettle back, or another issue that humanitarian action should start from zero again, because in the beginning we always put education, how to have a good nutrition, how to have a good sanitation, and so on. Now we are going to add how to live with the new normal in the future.
Thanks a lot, Siswanto. We have more question coming up. So three questions are suggested. So the first one is still again on localization and thinking about how we can really implement the agenda in a meaningful way. So Kevin, you pointed out one of the key obstacles, which is donor requirement and access to funding. But what could be, how can this crisis be used as an opening path to make this actually happen, and how can it be possible? Then the second question is about the restriction in movement that we have right now, and the border closure, and it's unclear when freedom of movement will be re-allowed and under what conditions. And of course, some people will be still deprived of that freedom. So how do you see the situation evolving, right? The also political and operational level when it comes to lifting this restriction. Will that happen soon? Well, we have to live with that situation for a long time. And then a last question is on the use of technologies, because we speak a lot about the use, like the age of digital humanitarianism. There's been a lot of critical papers and comments about the fact that online negotiation should not become the new normal. Do you see any trends when it comes to when it comes to the use of technologies, big data and humanitarianism, with all the issues, right, it may create on vulnerable people? So yeah, three key points. One on localization, because that's really a central theme. One on the restriction on movements, and one on the use of technologies. Will, do you want to comment on some or all of these questions?
Sure. With the localization, I think Kevin hit the nail on the head. There are many barriers to that happening, but I think what is becoming clear is, and hopefully what comes out of this crisis, and maybe one of the silver linings of what we're going through, is that the demonstration of local agencies to be able to deal with the situation and to be capable, to prove themselves capable to, and hopefully those situations will get through to donors and to intermediaries to say, yes, we as intermediaries are probably not as necessary as we thought we might be, and donors might then start to realize that it is okay to fund directly local organizations. And I think there needs to be more work done around that. And I think what Save the Children are doing, what other World Vision and others are doing about building capacity of their local partners is a really great thing to be doing. But there also needs, what is that time when you step back from that? What is the advocacy that you make to the donors to say, no, this is ready, this now needs to be done. So that direct funding mechanism needs to be there, and that needs to be a system-wide situation. It also needs to be recognised by the UN and others that local agencies are able to do that, and where they have proven that they can do that, they should be able to be carry forth with that. So those are the sorts of things that need to happen. Then there's also that whole issue around localization in conflict. Maybe there are situations, and it is, you know, as local as possible, as global as necessary. There are going to always be situations where you cannot go down a fully localized route. But what are the machinations? What do we need to put in place to ensure that it is achieved as much as possible wherever it is possible to be done, and review the role of all the players within that, be donors, be the UN, be the INGOs as well. Where do they all stand within that? Are we all working towards trying to achieve the same thing? Do we have a common understanding about what we are trying to achieve, or are we working against one another in that? So in regards to that, I think it could be proven to be a major shift within that. And I hope to see that is the case. The restrictions on movement is an interesting one. Until there is an effective vaccine that is available, especially to the most marginalised populations, but also globally, then there is going to be restrictions on movement. And the restrictions on movement are not just going to be about, yes, you can't fly. And that's probably going to be, I don't know, at the university, we're looking at probably 12 to 15 months before there is, you know, mass movements of people around. And even then, is even the aircraft that are flying now, the commentary around how do you have social distancing? So it brings in that new normal. What is the new normal for flying on an aircraft? And do you have aircraft flying with a dozen people in it? Because that's the social distancing that's required to do it. Certainly uneconomical. What are going to be the implications of that? I think the restrictions are going to be there. It is going to influence how people react. It is going to make the new normal. So if we're going to be looking at that, I think it's going to be a very interesting time. And again, the added impact of that, what are the flow-on effects for that, for tourism, for other things that a lot of countries rely on? So there's going to be a great many impacts of that to happen. Use of technologies, I think whilst there has been great use of technologies in many ways, and I think that is going to increase, the use of online negotiations, I think, is going to be there. It is, I think a lot of people are seeing that those are possible. And whilst we might not like it, I think they're going to become more a part of what is going to be happening, except where it really cannot be. And there needs to be specific understandings about where it can and cannot be. But I think technology is also going to create, where is that digital divide between those that can actually access the technology and can access the what is available, and those that can't. And I think potentially that could be exacerbated if there is more use of that without that being addressed, without that digital divide being addressed. I think it could exacerbate some of the issues.
Thanks, Phil. Kevin?
Well, on localization, I don't have an awful lot to add to what Phil has said, but I will say that I think part of the problem that we've got in the international architecture is that there's way too much subcontracting going on. So there are too many intermediaries between the source of finance and the source of delivery. And with every intermediary, the resources that flow through the system get diminished. So, you know, the World Bank decides it'll move resources into an area to support a refugee response. It'll subcontract one of the UN agencies. And one of the UN agencies will then subcontract an international NGO. And then the international NGO will work through local partners. And I think we sort of need to turn that model on its head, and it's not straightforward because you do have to have proper reporting systems and safeguarding systems and all of that sort of stuff. But the presumption that everything should flow in that way, rather than focus initially on the provider on the ground, I think has to be challenged much more actively than it is being challenged. I sort of think that, in all honesty, in the last few years, the localization agenda has not moved as rapidly as all of us anticipated and hoped, and maybe all of us need to be doing a lot more to try to drive that. I mean, the one thing I will say that, you know, in Save the Children, if I think of our Somalia program in Save the Children, just to give one example, so we have over 900 staff in Somalia. I don't think there's a single non-Somali in country. You know, so de facto international NGOs can become highly localized in the way that they deliver. But I, you know, I realize also that that's only part of the way towards what Phil is describing. On the these lockdown issues, I think you have to look at them case by case. And one of the things that we've learned from some of the initial lockdowns, you know, if you take the way that the lockdown was applied in India, with really no reference to the circumstances of migrants who are living in urban slum areas, who had no means of support, no means of savings, who were often forced to walk home hundreds of miles, many of whom lost their lives. I mean, certainly a lot of the slums, if I think of Lagos or other countries in Africa where we're working, you know, the idea that people can lock themselves in their home in the way that you might be able to in Groningen or Berlin, it is frankly ridiculous. You know, these people don't have fridges, people don't have savings. You know, being told to wash your hands when there's no source of clean water in a slum. So, you know, I think the reality is that governments have to find ways of promoting socially responsible distancing without driving people into deeper poverty. And that is a major challenge. It is actually an example of the second order of challenges that I think are coming down the road. You know, I mean, the one thing that we do know is that the number of people living on less than $1.90 a day in low-income countries is probably going to rise by around 60 million over the course of this year, and by considerably more next year. Now, you know, these are not people who can be put into extreme lockdown situations, so we have to find ways of scaling up cash transfer programs, supporting livelihoods, and so on. And then on digital, look, the only thing I'll say on digital, it does have great potential. And I've mentioned cash transfer programs several times. That we've invested a lot in digital platforms for cash transfers, which are a way of reaching highly marginalized populations in Yemen or Somalia in a way that you couldn't with normal targeting devices. At the other extreme, you've got this slightly surreal digital narratives, like, you know, people arguing that we can reach the 1.3 billion children who are now out of school through digital distance learning opportunities. You know, 90% of these children who are out of school aren't even digitally connected. So I think we have to be realistic about what is achievable, but obviously digital does have a great potential if it's applied in the right way with a view to equity.
Thanks a lot, Kevin. Siswanto?
Let me give a comment on the restriction of movement. Indonesia is not following the policy on lockdown. Only few provinces there is some restriction on movement, like Jakarta and East Java. Not in my city in Yogyakarta. In fact, the life is normal. And in the past week, there is a zero new cases came out. So we put a lot emphasis on the social responsibility to make it social distancing and so on and so on. Because, you know, lockdown has two implications. One, that people cannot generate money. Second, the government has to subsidize those who are not working and so on and so on. So in the sense that the restriction of movement in Indonesia a little bit, easier compared to even Singapore and also Malaysia, for example. Malaysia has used very strict lockdown. If you came out from your house, you will be punished and so on. Not in Jakarta. Even Jakarta has been considered as the PSBB, as I said earlier. Now, on the issue of digital, this is really a blessing in disguise with COVID, because then distant learning for primary school, secondary school, until university are now mushrooming. Everyone using Zoom, like us today, for the lecture and so on and so on. But of course, we have to pay special attention to those who are needy, to those who are not able to access internet and also no quota for internet and so on. That's the responsibility of the local government. They can allocate their fund to give to the household who need those kind of assistance and so on. So localization in my country is really relevant for the decentralization policy, which the government already mandated that all of local governments should plan their budget for COVID in a certain amount percentage of their regional budget, in addition to the assistance from central government, like cash transfer, like education subsidy, and so on and so on. So that's what happened in Indonesia, and of course it's rather unique in Indonesia. As the international NGO, you cannot go directly to the district or to the village. You have to be permitted by central government coordination with Minister of Foreign Affairs, Minister of Interior, and so on. Therefore, it's only few NGO who really work at the local area, those who have already approved by central government, including UNDP and UNFPA. They have to be approved by central government. So that's not the same like an African country. You can go directly to the district or village. Thank you.
Thanks, Siswanto, and thanks you all. That will be our final round of question before leaving you the floor for some concluding remarks, if you have any. I know Christina has one question, but I will ask two questions that came out from the chat. So first one is on cash projects, and especially in education. Somebody is asking for more information about the experience of Save the Children and the type of modalities you use in cash. Is it voucher? Is it like free meal, etc.? And the other question is on how do you assess the impact of that type of project? So what are your again modalities of impact assessment? And then we have a general question on education. Well, we are in NOHA, so a general question on how do you see evolving the training and of the future generation of aid workers? Does the crisis reflect some huge gap in the way we conceptualize training in the humanitarian sector? Some new skills that need to be developed? Any questions on that? And Christina, if you want to ask your own question, I leave you the floor.
Yes. I mean, I was thinking, and I would like to know what the issue is. The land. I mean, what you are the situations you are describing, and we know. I mean, we are going to have an exacerbation of vulnerabilities, rising inequality. You mentioned the digital divide. There's going to be a huge demand for funds, but not only, in places where there were already humanitarian crises, but we know in Europe, and I think, Kevin, you mentioned this human crisis. I tell you, yes, the situation in Spain, we are speaking about 30% unemployment, rates. So this is what, I mean, there's going to be a reduction of funds for international cooperation. And I will say that we foresee a competition for funding, this could be, I guess, maybe an incentive for collaboration, for really more collaborative efforts, but it's going to be a real challenge. So I just would like to, to know which are your thinkings about it. I know, I mean, the UK is always the leading donor, and I would say in Europe, everyone looks at what is going to happen in the UK in terms of as a donor. But I think this is really something that we need to think about. Thank you.
Thanks. Phil, do you want to start with some comments?
I wondered whether Kevin wanted to go off with those two around the cash project, cash programming modalities.
Yeah, we can tackle this one, Kevin, if you want to start discussing the question together, and especially the one on cash programming.
Well, so in most contexts, cash is the most effective, immediate way of delivering benefits in areas like nutrition and other areas. So I would say the vast majority of our transfer programs are now cash transfer programs. Some of them have a voucher element. So, you know, it might be, as it were, like a restricted cash transfer. You know, you have to spend the cash on specified items. And in fact, we even have a program in the UK where we're responding to the impact of COVID on low income groups in the UK with an emergency grants program, which is essentially, you know, vouchers either for cash or for, you know, basic household items. There's an awful lot of evaluation work that's been done on the effectiveness of cash. So we have some in Save the Children UK from our work in Somalia and Nigeria in particular that stand out. But if anybody's interested, there's a comprehensive review that's been done by the Overseas Development Institute of the impact of cash transfers and social protection more widely. So maybe, Clara, I won't say any more about that. Is now the time to make a really quick closing thought?
Yeah.
So on like on the question about education, I would say this is really the moment for all of us to be thinking about the future, not in a blue sky way, but in the way that, you know, the world is changing in directions that we couldn't have imagined. You know, I would say to anyone who's listening to this, try remembering the world as it was in November 2019. Mm-hmm. And it's a real struggle, right? Like the debates we were having then, you know, were debates about, can we accelerate progress towards the Sustainable Development Goals? The debate now is, can we stop a huge reversal of progress towards the development goals? You know, back then we were talking about, can we expand aid budgets as growth in high-income countries continues? Now the only debate is really about how much aid budgets are going to be cut or diverted into other areas. So this is a fundamentally new reality. And I think, you know, whether you're on or you're teaching a humanitarian course or an economics course or a politics and international relations course, the world has just changed and we have to pivot. And I think the institutions that don't pivot are going to pay a very high price for not pivoting. So that's just a quick reflection on that. The last thing I wanted to say was, you know, Benjamin Franklin, who was one of the drafters of the US Constitution, when they were doing the drafting, you know, there were big debates that were going on about the wording of the Constitution in different areas, and he came up with this wonderful phrase, which we all has gone into history, that look, because this was when America was still ruled by the British, and we had a bad habit at that time of hanging people who agreed with us on the future colonies. And, you know, that Benjamin Franklin said, look, either we all hang together or we're going to hang separately. And to me, that is the single greatest lesson of this pandemic. that I think anyone who's of a progressive international disposition really now has to stand up and fight for it, because this pandemic has taught us that it doesn't matter how rich your country is, you're still vulnerable. If you can't cooperate, it'll make you more vulnerable, not less vulnerable. And you basically need to stop listening to people who are offering you this false hope in the form of take back control of your borders, make the country great again, you know, my country first, everybody else second. This stuff is dangerous for everybody, and we really have to stand up and fight for it. And I think as part of that, you know, we have to recognize that the institutions that we now have, you know, they weren't fit for purpose before this crisis. But, you know, we have the governments in Europe and the US have essentially torn up the rule book on fiscal policy and monetary policy. You know, the European Union is putting together a $750 billion recovery package. The US has put together a $2 trillion recovery package. In the international system, we still have the World Bank and the IMF shuffling around little amounts of money because their shareholders won't let them go further. That is a prescription for rerunning the 1930s. And so I would say, as part of this new agenda of thinking universally, behaving like internationalists, supporting localization, you know, this is the moment where we need to make and win the argument for a new world order. So that's what I would encourage everyone who's a student who's listening to this to spend their next few years doing.
Thanks a lot, Kevin, for very insightful concluding remarks. Phil, the floor is yours.
So thank you. I would just like to wholeheartedly support Kevin's perspective there. I think it is time. Education, the evolving training of new workers in the aid sector, they need to be made aware of the change that is there. It is a pivot. It is not going to be the same. We are not going to be moving back into a system or back into a situation that we have ever known before. They need to be critical. We need to be examining and understanding that whole internationalization. We need to be pushing that. We can't afford to be backward in making those arguments. I think it is going to be strong headwinds against those arguments. I think it's going to be a very challenging situation to do, but those voices need to be heard. And I don't think they've been heard enough in the last probably 5 to 10 years. We were lulled into a false sense of security that this was going to be okay, and this has really brought it undone. The second thing for me is, and it sort of goes back to one of the previous questions, is what happened we've spoken about the Spanish flu pandemic, mentioned that as the last global pandemic. More people died in the second round of that than in the first. And so we need to be mindful that, you know, with the easing of restrictions, with the changes that are happening, what is the possibility of that happening again this time round? And I think there's a real chance of that happening, especially, and then what are the implications of that then for the competition for funding, that whole nationalisation debate? I think it's going to be a crucial era for us to be going into. I would like to think that the world will learn that if we don't work together on this, then we will all come apart, and that the competition will turn towards collaboration and really work on a global level to make the changes that need to happen to enable humanity to move on to where it needs to be in relation to what the new normal is going to be.
Thanks a lot. Thanks a lot, Phil. Siswanto?
Yes, I just want to propose some, future education for our NOHA student. Of course, if it's only related to cognitive science, we can do distance learning like what we are doing in some of our classes now. But for humanitarians worker, they need to have a field experience. They need to have exposed directly to people. This is the same thing what we are doing for medical students. You know, we cannot stop them to face with the patient. You know, I think in analogy to that, even though there is risk for humanitarian students, they have to be brave enough to go to the field to see what is the real people affected by humanitarian crisis and so on and so on. So, you know, the changing on education, yes, it is possible to avoid face-to-face or contact with people on some issues, but for the experience, especially under the humanitarian crisis, we need them to go to the field. It's the same as medical students. They know that it is risk, but this is their responsibility in the future, that the risk is on them as well. That's what I'm going to close with my statement today. Thank you.
Thanks a lot, Siswanto. Thanks to you all for joining us during lunchtime and evening time for our colleagues in Oceania and Asia. It was really a pleasure to have you all. The good thing with YouTube is that people will be able to watch and rewatch the webinar. But really, on behalf of the NOAA network, we would like to thank you for your availability. Cristina, do you want to announce the next edition, which will be in Spanish?
We forget to put that in. Well, first of all, I really would like to thank you, Kevin, Siswanto, and Filia, for your participation. I mean, you made me think about the Secretary General report for the World Humanitarian Summit. Remember, One Humanity, our shared responsibility, which was a call indeed, not for humanitarians, but for politicians, yeah. And I mean, I don't know, I think you are very right. We need to build together, collaborate more. I mean, I can say as an example of the NOAA network and our partners, we have spoken more in the last 2 months among ourselves, reaching out to our partners, fields, Siswanto, to different, and among ourselves to really try to respond and build together a better masters, a better program. And I think ways that we can help try to support partners in the South and to see what we can do together, yeah? So I think this is really an opportunity for all of us to as you said, to see how important it is to keep the internalization and to see how we can, support and strengthen global cooperation. So, I mean, I hope this series of NOAA webinars is also, a small step in this regard. And next, on the 25th of June, we will have one in where we have different people from Latin America. It will be held in Spanish. We know this is a limitation, but we think also we need to recognize a bit the diversity and other languages, but we will look for how we can translate it. And thank you, all of you, for participating. Thank you, the people that, all of you for joining us on YouTube. I'm sorry for, this is the problem of working at home. You see the telephone in the back. I'm sorry for that. So thank you. And we hope you can join us in the next webinar in June. And really, really thank you very much for your participation.
Thank you.
Thanks, Christina.
Thanks a lot.
Thanks, Clara. Thanks,
and
Kevin.
A special thanks to Will, right, for setting up the Zoom and everything on YouTube, our wonderful public relation officer, and Veronica Brown, who worked very hard on the backstage to prepare the flyer and send questions. So thanks to you all for this webinar, and we hope to see you in the next editions. Bye bye.
Thank you.
Bye.
Bye-bye.
Have a nice day. Bye.